Hi, my name is Anne Oland. Dr. Oland. And I work in Phoenix and Goodyear as a pediatrician in a private practice called Desert Valley Pediatrics.
My first question is, when did you know that you wanted to become a pediatrician?
So I would have to say it goes back to when I was actually a kid, and I had a pediatrician who was a fantastic, amazing role model, and I liked what she did. I thought it was interesting being able to help kids that were sick, and interesting career, and I sort of kind of kept to go into medicine.
How long did it take for you to finish this career?
A full college program, so it's typically 4 years, and then medical school is an additional 4 years. And then a training program could be an additional pediatrician. That extra training is 3 years of residency. Overall, it's 8 years of schooling. All the years of college, med school, and the training that were all really for pediatrics was 12 years of school. It took me 15 years to complete residency before I got my first job.
My third question is, what challenges did you face throughout your school career?
So I'd say the biggest challenge I faced for my school career is that I actually stayed for a summer session one summer and retook a class to get the grade I needed. I didn't get into a medical school when I applied for the first time. The option that became available to me was going to a medical school that was actually a foreign medical school, Caribbean. So I not only spent all these years and time, I then had to leave leave the United States for a few years to go to this other school, which and challenging experience, and work out, and you can still make your dream. You may have to go away for it.
What are the difficult things about your job?
So one challenge would be sort of treating each patient the age that they are. So it's, I spend a lot of time talking to the parents or the family member that brings in the information from them. And then as they get older, I have to really shift gears and be able to talk to the patient and make them feel that they're the patient and make them feel like definitely a challenge and an art. And we all try to do it. The young ones, when they don't talk, to get as much information from the parents, but then to also really still get in their ears and their mouth and do everything and kind of have them quiet, or at least get through the exam even if they're crying. So that's always a challenge every day.
And finally, what skills do you need for this career?
So there are many skills. A lot of the coursework that you need to get even into medical school, a lot of math work, a lot of science coursework. You really to be dedicated to memorizing and studying and reading and rereading and just retesting yourself. So just simply the classes and the coursework to earn a medical degree is challenging. I would say it'd be really important. You have to also be a bit creative. I think you should be creative in the way you use your medical skills and all your knowledge that you acquired. And you of course have to be quite patient. If the baby's crying, then sort of what I said before, that another challenge is definitely be able to switch gears when you're seeing different age kids, and they'll be back to back. I'll see a new, and you have to be a good listener. The parents often have a lot of questions, and I enjoy that. Of course, there's going to be harder diagnoses, and sometimes, if a patient has cancer or things like that, that we do have to share with patients, that's never going to be easy, and so that, you have to know how to talk to your patients as well. I'm fortunate that I'm able to work part-time as a pediatrician with my practice, and I think the career that I can be 100% dedicated to, but I can do it part-time. And then for someone, I find that medicine can have some flexible hours in pediatrics, at least. There are a lot, and is really rewarding. So I enjoy that I get to come into work and being able to help the kids. And then I guess there's one other thing that even as a pediatrician you can or as a physician in general, you can also do some other things with it. You can volunteer places. I do something else in the summertime. Each of my kids goes to an overnight summer camp, and they need medical staff during the summer. So I work 1 week at a boys camp and 1 week at a girls camp as the camp doctor. But that's this other little branch of something I do. I learn a lot over the summer. You can do lots of things as a pediatrician besides just coming to the office every day.
Thank you so much for your time. I appreciate it.
Sure.